Hello and welcome to What's Going On, the Martha Love Show. I am your guest host today, LaToya Sykes, and I am pleased to have with me today members of the Children's Community Health Plan. And we will be speaking with Vivian Watson, who is Outreach Coordinator for Care for Kids, Tim Rifle, who is Utilization Case Manager for Behavioral Health, and Sarai Rosario, who is a Community Health Navigator. So we'll start with you, Vivian, and I have a couple questions. I'll just ask my questions and we'll move right along. Sounds good?
Sounds good.
Awesome. So welcome to the show.
Thank you.
Tell me, what is Care for Kids?
Care for Kids is a program that creates a medical home for children who are placed in out-of-home care, as in foster care. The medical home is not exactly a brick and mortar place. The medical home consists of a team of an outreach coordinator such as myself, there's two of us, along with a healthcare coordinator. And we make certain that every child receives an individualized treatment plan that speaks to healthcare needs, mental health care needs, just to make certain that those children receive exactly what they need in order to increase their resiliency once they return to the community.
Wow. So when I learned that you were going to be on the show and what it is you did, I was very thrilled, because there's a lot of children who are in situations where their health records do not follow them from home to home. So tell me a little bit about what the specific goal of the program is.
Well, I would say that the specific goal of the program is to make certain that these children receive timely and developmentally appropriate services and care.
Okay.
For example, the children who come to our program who are between newborn and 6 months of age, the program requires that they are seen on a monthly basis from the newborn until they are 6 months of age, because that time frame is really very critical for those children. So we're keeping on track of them as far as those appointments, making certain that they occur and that they occur with those providers who are trained specifically to provide care for these children.
Awesome. So in our world of acronyms, tell me what TIC stands for.
That stands for Trauma-Informed Care.
Okay.
In other words, the providers who are trained in trauma-informed care are trained to address all types of trauma, not just physical, but psychological trauma as well, and not just saying the traditional question of what's wrong with that person, but what has happened to that person, and moving forward to obtain the information that speaks to their experiences that brought them to that caregiver.
Okay, great. So help me understand the role difference between the healthcare coordinator and the outreach coordinator.
As an outreach coordinator, my role is initially to reach out to that caregiver who, for example, has just received a child in their home. They're brand new to Care for Kids. I'm the voice that they hear that calls and says to them, this is Vivian calling from Care for Kids. I want to introduce you to the program. This is what we're looking at for this child for this particular age that needs to be seen by the provider. And maybe as a result of their initial appointment, I'm looking at the records before I call. I see that they need to be connected to, for example, a mental health provider. So there could be something, reverting back to the trauma-informed care, that maybe that I need to keep in mind that this particular child needs to see a gender-specific provider. Maybe their trauma was related to something that speaks to that, so I have to keep that in mind. Along with the caregiver, I have to keep in mind what their available hours are to make certain that they're able to get the child to that particular provider.
Right. So that is really great. And that is the role of, the healthcare coordinator or the outreach coordinator?
The outreach coordinator.
Okay, and then the healthcare coordinator does what?
The healthcare coordinator could either be someone who is a registered nurse or an advanced practice social worker.
Okay.
In my team, my healthcare coordinator is a registered nurse.
Okay.
So the distribution of the cases, if you will, that come in for children who are more medically fragile are typically assigned to the team that works with a registered nurse. Children who may have more mental health issues would be assigned typically to the team that includes an advanced practice social worker.
Okay, that's great. So in these two positions, the healthcare coordinator and the outreach coordinator. Can you tell me a little bit about the backgrounds that the team has?
Our team has a very diverse background in a very good way. We have varying experiences with the outreach coordinator. The requirement education-wise is that you have a bachelor's degree. A lot of us come from backgrounds of child welfare. Some have other experiences as well. And because we work in a team, it always comes out in a very positive way because we're able to tap into each other's skills.
Right.
And even though we work in separate teams, we still cross the line sometimes when we have to come together. Right. And maybe there's something going on a team that has an advanced practice social worker that they need to speak to a registered nurse. And we all come together because the ultimate goal is to provide the best care for that child.
Okay, great. So tell me, or actually give me some examples of how the team helps navigate behavioral or dental or medical needs for a kid.
For example, with the dental, oftentimes our children come in with dental caries, another word for cavities.
And dental caries. I've never heard that one.
Yes. So we have to speak to that pretty immediately.
Yes.
And we'll get them in to see a dentist. And we look at, as the outreach coordinator, before I call the caregiver, I see where they live. And for example, if they live in a particular side of town, I introduce them to the fact that children's is within the community. Okay. So there's, for example, a children's dental clinic that's on 50th and North. And maybe I say to them, I see that you don't live far from there. I can get you into an appointment there so that you can be seen. So it's always, the expediting part is always to try to get the child in as quickly as possible.
Right. That's really great. So tell me examples of how you expedite that care. So what is it that you do to help get that child in to see someone as soon as possible?
If the child has, the referral, for example, is one of mental health.
Okay.
Oftentimes that will require a parental consent prior to the appointment. So I make certain that I express that to the caregiver, that we need to get that taken care of. So that means that I'm reaching out to the ongoing caseworker because the work that I do is primarily behind the scenes.
Okay.
So that ongoing caseworker would be in a better position than I am to actually reach out to the parent as in going out and getting those consents to make certain that when that child attends the appointment that everything is in place, that nothing is missing that could potentially make the appointment take longer or have to be rescheduled. We want to make certain that everything is in place.
So what I hear you saying, you help to break down those barriers.
Exactly.
So how do you do that, and keep it individualized for your kids? How do you break down those barriers, prioritize what may need to happen for that child, and help get those services delivered?
Sometimes there are certain cases that you see more often where maybe there is speech delay and then the child needs to get in for a hearing test. And then it comes back that maybe the child needs to have tubes inserted in their ears. So whatever, depending upon the level of care as to how you proceed, but every child is important to us. There is no child that is not important to us, so we still move forward with the same intensity as far as making certain that I've touched bases with who needs to be bought into that part, whether it's the ongoing caseworker, maybe it's the caregiver, it's the biological parent, because we're still working with the parent as well. And we do have parents who, although their child is no longer in the home with them, they still attend the appointments. They still want to know what's going on with their child. So we are sensitive to that.
Okay, great. Thank you. So let's move over to my utilization case manager, Mr. Tim.
Hi.
Can you explain a little bit about your role as a case manager?
Yeah, when we pick somebody up for case management, the idea is that it's somebody who's likely been in the hospital quite frequently, been inpatient. So we really choose the members that we case manage carefully off of that list, and then the idea is getting into the home and seeing what's going on. What's brought them into the hospital to begin with was typically some sort of behavioral health need, whether it be depression, anxiety, or suicidal ideation, or substance abuse issues are typically the main ones that bring somebody inpatient. But when we get involved in the house, we realize why it is that that's continuing to happen, why they're not following up with their outpatient programs once they discharge. It's because they're having issues with paying the rent, getting food in the house, or they don't even have a house to live in or a place to call home. They've got kids in daycare and they can't afford that. So a lot of the times those behavioral health needs, as much as they're right in the forefront and very present, need the assistance of somebody like myself to come in and say, okay, let's get some of these things taken care of. And I can utilize somebody like Sally here, and picking up the finding different resources around in the neighborhood, whether that's rent assistance or finding some food or ways to get the food stamps, and all those things are really what they need in order to help them kind of stay out of the inpatient facilities. And then when some of those things are taken care of and they got that stress off of their plate a little bit, we can start incorporating some of the behavioral health needs, following up with therapy appointments, continuing with their med management and along those lines.
So how do you work with your coworkers to ensure that the Children's Community Health Plan members are receiving the services that they need?
Well, like I had said, with Sally E, it's talking with her and figuring out if I don't know an answer about how somebody can get certain community resources, I'm going to pick her brain about what she's got out there that I don't know of, because she's got some experience and knowledge that I'm not aware of. And when it comes to some of the kids, for the other half of my job, the utilization management piece, we see these kids come in and we do the insurance reviews on them. And that's a lot of the times for Care for Kids with Vivian, that they don't know that these kids are, inpatient, and they don't know the status of it because it's not as frequent. Where, when I see it that there's an inpatient, I, shoot an email out saying, hey, this member is currently in the inpatient facility, and that gets them involved with the treatment team at the facility that they're at, so that we make sure that all parties that are at CCHP know everything that's going on, because otherwise they're kind of left in the dark of like, oh, they had, they were in the hospital 3 times in the last month and they were completely unaware of it. And, we want to get as many people involved as possible in order to be able to help and have the healthiest kids around. We are under the Children's Hospital realm, and they want the healthiest kids in the country. And at CCHP, we want to have the healthiest members for all of that. So we want to make sure that everybody that can be involved is involved.
So we all know that when you work with kids and they have illnesses or some other thing that they may consider hanging over their head. Can you tell me how you deal with that? How do you work with reducing the stigma surrounding certain illnesses or diagnoses?
There's a big challenge with that right now. Unfortunately, mental health, behavioral health itself right now has a bad rap.
Yes.
It's really put out and portrayed negatively in the media. And right now we've got a handful of different things that we're trying to do, partnering up with a variety of communities. That's kind of what separates us differently at Children's Community Health Plan, is we are trying to partner up with as many people as possible. And that's not just being a sponsor for something, that's actively being involved. I've got 2 examples. One is with NAMI of Greater Milwaukee, and that's the National Alliance on Mental Illness.
And that's the National Alliance on Mental Illness is one of the partners.
Yep.
Okay.
Yep, and it's of Greater Milwaukee, so it's a national organization, and there's a Greater Milwaukee branch, and we've been partnering with them very closely with a lot of things that they've got going on. One that's coming up soon is a walk down on Veterans Park, and we've got the whole behavioral health team as a part of it. We're encouraging the rest of the CCHP to be a part of this walk as well, and just get it out there, get the awareness out. And me personally, we're trying to get donations, so this is a nice thing about social media.
Yes.
I can post on there just saying, hey, looking to get a donation. Can you help out? We're just trying to reduce the stigma, and that alone, draws a ton of attention to it. I've got friends that I didn't even know might be struggling with some of these issues that had commented on a statement like that, and so it's right there for me. That's kind of proving its point. And the second piece, the second organization that we're teaming up with is a play in the Milwaukee area called Pieces in My Own Voice.
Okay.
And it's a local play that's being done downtown, and it's basically just a variety of different disorders and diseases, mental health diagnoses, depression, schizophrenia, and it's putting it into a perspective. So not a lot of people know and understand what's going on. And something that I took from it personally was one of the characters was talking about how they don't identify themselves as a disorder, so why is everybody else?
Okay.
You know, so if somebody's got cancer, you're not saying, well, hey, cancer, how's it going? You know, you look past the person, it's, oh, I'm so sorry you have that, and then you try to do what you can to help. But if somebody says, well, I have depression, or I'm suicidal, or I'm anxious, it's looked completely different. You know, somebody else goes, okay, I maybe don't want to be around that person. It's even more challenging as a teenager, excuse me, in college or in high school.
Great.
And
So that play is called Pieces?
It's called Pieces in My Own Voice, and I'm not sure on the exact times. But
Okay.
it's.
But will
they've
that
got a
be on your website?
Yes, it will be on our website. They have their own website and a YouTube video that kind of
Okay.
has a little glimpse of it too. So if you look up Pieces in My Own Voice, you will be able to find that information there.
Great. Thank you.
You're welcome.
And Ms. Sarai, my health navigator, tell me a little bit about your role.
Sure. Basically what I do is I work closely with families who have utilized the emergency room more so than other families in a short period of time.
Okay.
And during these phone calls that we make to them to reach out to our families, we kind of talk to our families to figure out what's going on. So we come out to the homes and either help them establish primary care, if that may be the reason why they are utilizing the emergency room rather than using a primary care physician.
Okay.
And a lot of times we also realize that the reasons why they don't have a primary care doctor is because, as Tim was saying, there are many other aspects in their lives that are prohibiting them from using the primary care facilities. And at the times when the emergency arises, they are utilizing the emergency rooms.
Okay, great. So what are some of the things you are doing to ensure the health and well-being of a children's community health plan member?
A lot of this is educating and also empowering our families. So we want to educate our families on the health resources that are out there and that we can help network with.
Yes.
And that can be from helping them establish themselves as a patient at a primary care doctor, or find the community resources that will help them as well as the rest of their family within that whole household to get the best quality care that they can.
Okay, great. So how do you collaborate with your fellow coworkers? Tell me what that looks like for you.
We actually do it on a day-to-day basis.
Okay.
I think that by utilizing our fellow colleagues, we get to bounce off of different ideas. Maybe someone had a family or a member that they've worked with previously who had some of the same needs or concerns, and I may not be as knowledgeable, and by sharing my cases or my families with the colleagues, I get to establish that knowledge where I can better help care for my families as well.
Great. So tell me, how are you working to reduce the stigma associated with certain illnesses and diagnoses?
Well, a lot of that is also educating myself. And I think until I am educated, can I then only be able to assist my families in educating them, but also using our community agencies, find programs or awareness activities that they are also holding, is when we provide our families with those types of resources that they can attend those meetings and neighborhood activities as well that are in their reach.
Awesome. Wow, this team from our Children's Community Health Plan organization is awesome. I appreciate the fact that I've heard multiple times today about how the team works, how you collaborate, how we reduce the stigma behind certain illnesses and diagnosis. So I just have to say I'm so thankful for having you all here today and appreciate all the hard work you do.
Thank you.
Thank you.
An MCM production.